Again, to our top story, some business leaders eyeing separating vaccinated and unvaccinated workers. Let's get the thoughts of the health department on this and other matters. We go above and beyond the headlines with Health Undersecretary Rosario. Vergeire. Ma'am, good evening. Thank you very much for joining us. Well, let's begin with that particular point. A few business leaders talking about segregating workers, the vaccinated from the unvaccinated. What does the health department think about this?
Well, actually, ma'am, there is no really real science when we talk about these things. No, it's more of an ethical issue and discrimination issue. So when you talk about incentives and disincentives for vaccination, we can be able to do that if there would be equal terms. Like if you say that there would be a separate elevator for those who had been vaccinated, an elevator also should be offered to those who were not vaccinated. The idea of isolating or segregating those who had been vaccinated from those who had not been vaccinated, dapat equal po yung ibinibigay natin na opportunity or benefit. So that's because the objective really and the intent would just be for us to have that kind of protection among those who had been vaccinated. So maybe that should be discussed also further with the other agencies and also with the Department of Justice if we are going to have this kind of implementation and if there would be some legal or ethical issues concerning this matter.
Yeah, legal and ethical issues, ma'am, like you were saying, a discrimination issue also. So it's really more a problem of siguro infrastructure, like you were saying, separate elevators, separate offices, separate rooms, separate baka separate comfort rooms pa nga eh. So in other words, it's something that we don't need to do. Ganun po ba?
Well, right now, because of the strong vaccine hesitancy, we are now trying to think of incentives and disincentives, no? Incentives for those vaccinated and disincentives for those not vaccinated or refusing to get vaccinated. And this can be one of those disincentives or incentives for those vaccinated. But as I've said, when we do this, it has to be on equal ground. Like, for example, if we say that the elevator would just be used for vaccinated, there should be another elevator for those unvaccinated, so that we can be able to emphasize to them that we are doing this for that intent, that we would just want to protect more these vaccinated people.
Yeah. Ma'am, I spoke to Father Nick Austriaco a day or two ago, and he was saying that a very good incentive for people to get vaccinated is if they are looking forward to the traditional Filipino Christmas, meaning simbang gabi, family reunions, getting together with friends for Christmas. And he was saying that would be a good incentive for people to really, para maisantabi na yung vaccine hesitancy. Is that something the DOH is also pushing for?
Yes, ma'am, very much. No, so this is what Secretary Galvez would always say, no, a happy Christmas for all of us. So if only we can reach that threshold or that level of population coverage by Christmas time, and then we will be able to do that. So hopefully that would be a good incentive for all of us, and people who are now refusing or are uncertain of being vaccinated will be motivated to get vaccinated because of this intent or objective.
So siguro ma'am, yung mag-organize mga family reunions, Christmas parties, when they pag dumarating yung mga mag-a-attend, kailangan makita kung kung meron silang vaccination record or not, no? But anyway, ma'am, another question, pinag-uusapan, sinasabi ng OCTA na dapat magpadala daw tayo ng more assistance to Mindanao and Western Visayas. What is the DOH doing about this?
Yes, ma'am. We have been doing that for the past weeks already. We have sent mechanical ventilators, high flow nasal cannulas, pulse oximeters. We have sent testing kits, additional. We also have facilitated the licensing of other laboratories in this area so that we'll be able to have more access to testing. We are sending now antigen test kits so that they can use it. And also, we were able to assist them into expanding their hospital capacity. So for all of these regions in Visayas and Mindanao, they were already able to expand their ICU beds up to additional 365 beds. And for their hospital beds like isolation and COVID ward beds, they have expanded already about 957 beds. So the assistance is there. We recognize that fact that they are having this increase in the number of cases, and the Department of Health is here, no, to support and provide additional resources, even manpower. We already have that additional budget for them, and then emergency hiring is being undertaken.
Ma'am, what factors would determine if the DOH would agree to having minors vaccinated, like 5 years old and up, 5 hanggang 12, for example? I mean, apart from supply or the lack of vaccines and approvals for these vaccines for the younger population.
Well, first, we need to base our decision on science. So there had been these initial results of trials that had been done in other countries, and there was this emergency use authority provided to one of the manufacturers. But we would want to study it further. We would want to have more studies being published because these are the children that we are talking about, and we want to be very, very sure that this is going to be safe for them. Of course, aside from the fact that, as we all know right now, we have a challenge in supplies, and that we have tried to analyze our studies or our data here in the country, that we see that the children have the least risk of getting this infection
Ma'am,
and of getting infection.
Yusek Vergeire? Okay. Well, one last, you hear me well, and I hope our signal is still up. But Secretary Galvez has endorsed a request from the League of Cities of the Philippines to include other high-risk areas outside of the NCR plus 8 area, no, para madagdagan yung supply ng bakuna. Is this something that the DOH can work on? Because there's parang we kind of sense a little bit of panic in those areas.
Yes, ma'am. No, so primarily, let me just tell you that about 60% of what we are going to receive for our vaccines that are being delivered in the country right now would be provided to these areas outside of the NCR plus. But people has to remember, and our local governments have to be informed, that it is not just the vaccines that we can use for us to be able to manage our cases. We need to ramp up in the time that they are detecting and then they are isolating. Because right now, our average is about 12 days for the whole country that we detect. And then that's the time after 12 days, that's the time that we are able to isolate patients or individuals. So we need to cut this chain of transmission. We need to be able to have our citizens comply with minimum health protocols so that we'll be able to manage the rise in cases. The vaccines are just additional or supplemental to this response that we are doing.
All right. Undersecretary Rosario Vergeire of the Health Department. Ma'am, thank you very much for joining us this evening.